Welcome. My name is John Johnson, and I am the Program Director for Domestic Policy with the Evangelical Lutheran Church in America, and I will be your moderator today. Thank you all so much for joining us to learn more about the COVID-19 pandemic and everything that is or isn't happening in Washington, D.C. in response to it. We know it's hard to keep track. Over the next hour, we are delighted to share with you the latest efforts of our elected officials and where the faith voice can be particularly powerful in this moment. We are recording this webinar and we'll post it later today. We also have a document you can download, which includes all of the specific policy asks we'll go through during today's presentation. Before we begin, we want to extend our deep appreciation to Tammy Gilligan and the Jewish Council for Public Affairs, and all of our presenters and advocates for making today's webinar possible. Now, let's dive right in. First, it's my privilege to introduce Sister Simone Campbell, the Executive Director of Network, a Catholic lobby for social justice. Known also for the Nuns on the Bus cross-country campaign, we couldn't imagine a better person to ground us and share a few reflections in opening this webinar. Sister Simone, welcome.
Thanks so much, John. It's an honor to be with all of you around the country in this really critical time. I wanted to share a few reflections as I was pondering this. I think yesterday when I heard that Boris Johnson, the Prime Minister of Great Britain, was in the intensive care unit, I realized how critical it is for leaders in our world to be healthy and to be able to do what they need to do to be leaders. But I also realized, as I read this morning about the grocery store workers who have died, who've contracted COVID-19 through their work, what service is being provided to all of us. So it's not just a question of leadership, it's also a question of all of us together. And then you see healthcare workers, doctors, nurses, the orderlies in the hospital, the cleaning staff, the clerks, the list goes on and on. Because in one way or another, we are all impacted by this dreadful disease. We are stopped as a nation and as a world. How many people have lost their jobs? How many people are out of work? How many people are still employed but not able to go to work? How many people in our nation are impacted? Well, we in the Washington interreligious staff community are together with you just for that reason. We work in DC in the interreligious community, Christians, Jews, Muslims, Baha'i, Sikhs, Buddhists, we all come together in order to advocate for policies that care for the common good. We have been working flat out for the last 3 weeks on Capitol Hill and you're going to learn about what we've accomplished and how much more there is to do. But what I've come to realize as a Catholic Christian in this week that we call Holy is that this really is a time of struggle and for many of dying. But my prayer is consistently, will we know, please let us know, O Spirit, the discovery of community, of new life beyond this moment. And that's why I take a little glimmer of hope that we got some unexpected votes for legislation that cared for more than those at the top, that actually sent money to those at the bottom. And some of those that voted for it might have resisted, but they finally voted for it. But in the end, I came to realize that they themselves saw themselves as in need. And isn't that what faith teaches us? Is that we are all one, we are all connected. And if we don't share faith, we at least share our Constitution. Are we the people trying to form this more perfect union to establish justice and secure domestic tranquility, provide for the common defense, and promote the general welfare? What you're going to hear today is how we've been trying to do that and how much more work there is to do. And that's why we need you. We need everyone involved because it really is about we the people. And in my tradition, we say we are one body. We are connected in this time of suffering and of worry, but we are one body making a difference in our policy. So join us, listen in, and then put your representative's office on speed dial. You probably can't go visit them right now, but you can call them on a regular basis. We need you. We need to be together. And that is how we can move forward. So thank you for this opportunity to start off this great education on what we've been up to, what we've accomplished, and what more there is to do. Thank you so much. Back to you, John.
Adams. Thank you, Sister Simone. Now we'll hear from Katie Adams, policy advocate for domestic issues for the United Church of Christ, to explain briefly what Congress did in the last COVID-19 recovery package. Katie, welcome.
Thank you, John. Signed into law just a few days ago, the C.A.R.E.S Act, or the Coronavirus Aid, Relief, and Economic Security Act, includes about $2 trillion in overall spending. It works on parallel tracks to prevent, or at least dampen, the economic impacts of the pandemic. While it will soon be eclipsed in size by following relief and recovery packages, it's important to see what's there and also what isn't there. Joblessness claims will continue to rise, and measures in the bill to combat that include cash payments to taxpayers. Most individuals earning less than $75,000 a year can expect a one-time cash payment of $1,200. Unfortunately, the bill ties the payment to a Social Security number and tax filing status that will exclude many immigrants and mixed immigration status families, as well as those who don't or are unable to file taxes. The bill also expands unemployment insurance access, giving states greater flexibility and increased benefits and eligibility qualifications. The amount still varies state by state, as does the time that people are allowed to claim it. Workers and freelancers who lost their work as a result of the emergency, the bill creates a program called the Pandemic Unemployment Assistance Program. It will run through the end of this year to help people who traditionally wouldn't have access to unemployment insurance. To further prevent layoffs, the bill creates a fully refundable tax credit for all businesses to help with payroll, so employees can be hired back and have jobs to return to. For small businesses, that means companies of less than 500 employees nationwide, the bill offers emergency grants and forgivable loan programs and changes in loan requirements to make it easier for companies to keep employees on payroll and stay open in the near term. For large businesses, about $500 billion was made available for loans, funding corporations, including the airline industry. This is to cover salaries and benefits so they can stay open. Additional healthcare measures, including plus-ups and funding for hospitals, community health centers, restocking the national stockpile, and extending telehealth, as well as a requirement that treatment and testing be covered by insurance companies, was included. In terms of helping especially vulnerable populations, though, the bill falls far, far short. We'll cover in a few minutes the many ways that we want to make sure the next package includes coverage for vulnerable populations. There was some expansion of nutrition programs and funding for SNAP, child nutrition banks, but no expansion in the maximum SNAP benefit for recipients. The bill also did not include moratoriums on Trump-era administrative rule changes that aimed to pull off of public assistance programs, including Medicaid, SNAP, and public housing. There was about $4 billion in assistance for emergency grants to help people avoid homelessness and includes money and rental assistance, but quite a bit more funding will be needed to prevent a very large surge in homelessness. Part of any recovery plan will need to include commitments to emergency and ongoing rental assistance, as well as assistance for utilities. Bill created an inspector general to oversee the pandemic recovery, and we're already seeing that that's something that the president has interfered with. In student loan relief, the bill deferred payments on federal student loan payments through September 30th. In a nutshell, the C.A.R.E.S bill is pretty big, and I just gave a pretty quick overview. The supplemental materials that we'll provide you as part of this webinar will help you learn more about what we want to see in the next package of bills and making sure that the vulnerable people that we advocate with and for are included in further legislation. Thank you very much. Back to John.
Now we're going to hear from our policy experts and leaders in the Washington interreligious staff community who to the legislative tasks from our faith-based lens. I'll introduce them now. We have the Reverend Andrea Alexander, who is Associate General Secretary for Action and Advocacy for National Council of Churches USA. Aaron Copper is Congressional Advocate on Native American Policy with the Friends Committee on National Legislation. We've already met the Adams. We are also joined by Jacob Greenblatt, Senior Legislative Assistant for the Religious Action Center on Reform Judaism. Jason Miller is the Director of Campaigns and Development for the Franciscan Action Network. Rebecca Eastwood is an Advocacy Coordinator for the London Center for Advocacy and Outreach. And we have Jalal, the Senior Advocacy and Government Affairs Advisor for Islamic Relief USA. Colleagues, the question for you is what needs to be a congressional package? I'll ask you and
Hello?
Go ahead, Andrea.
Okay, I'm sorry. I think
Sorry, folks, for the
We're
technical
so sorry for some of the technical difficulties, but please stand with us. We've heard over and over again that the coronavirus does not discriminate. People in every economic and ethnic, sexual identity and different levels of
Sorry, Andrea, I'm going to ask you to just pause and we're going to try to figure out what's going on with the audio. So if folks could just give us a minute or two. We're very, very sorry. So for the presenters that we have, if you're on the phone, we're gonna have to ask you to exit, please, and use the links that we provided you. Okay, Andrea, we're gonna have you go ahead and try again and see if that helped.
All righty. Hello again. As I was saying, we've heard over and over again that the coronavirus does not discriminate. People in every socioeconomic station, ethnicity, sexual identity, and differing levels of ability have been affected. No, the virus does not discriminate, but the systems and structures that are responsible for responding to it does. Before we were #1 in confirmed COVID-19 cases in the world, we already ranked #1 in the number of people incarcerated. Given the overcrowding of jails, prisons, and detention centers and compromised sanitary conditions, these facilities are like large petri dishes where the virus can grow and spread. An uncontained outbreak within a penal facility or detention center would be catastrophic. It would be immoral and inhumane to not do everything to prevent such fatal outcomes. As people of faith, we want to ensure that those in these facilities are not made invisible. And as noted, even though the virus does not discriminate, we want to point out that we are finding already that people of color are dying at proportions greater than their demographic makeup in every community. And as we know, those incarcerated because of the race and class disparities embedded in the penal system, people of color, poor people, and those with underlying health issues will be most detrimentally impacted. So what can we do? We've highlighted just a few things that, that we can do at this point. There's a whole lot, quite frankly, and I'd ask for you to continue to keep in touch with what's happening with WISC and with the National Council of Churches and Interfaith Criminal Justice Coalition. But first and foremost, at this point, I'm going to lay out 3 immediate things that we could ask for. 1, release as many people as possible. In order to stop the spread of this disease within the penal system, there can be an immediate release of elderly and medically vulnerable. We could have early release for anyone within 18 months of their release date. And then for those who are released, we need Congress to lift any ban to access social services and housing for those who will be able to return home. People have to have somewhere to go. And this is not just some blanket release where people are just going to be let go. There are mechanisms that could be used to determine how these people can be released. We're also asking that those who are confirmed cases inside, that they're able to be treated by healthcare professionals in a healthcare facility, and then not be put in isolation or solitary confinement as a way to, as we're doing, self-isolated in our own homes. That is like extended punishment for them being ill. Secondly, prioritize the general health of staff and those who are incarcerated. Many people don't realize it, but inside prisons and jails, access to soap and water is not necessarily readily available. And so people can't even follow some of the very basic CDC guidelines for hygiene. Also, create, publicly release, implement, and enforce a policy that is vetted by public health officials on how each facility will handle COVID-19 cases and prevent the spread of the virus inside. Right now, we don't have any way of knowing what's happening inside these facilities. And then finally, in this category of things that we could immediately do, we're going to ask that you encourage local, state, and federal facilities to attend to the emotional and spiritual well-being of everyone. Given the limitations to face-to-face visits and to boost the emotional and spiritual well-beings of everyone, we're asking that families and those who are in the staff and for future legislation that would include free unlimited phone calls, free unlimited video conferencing, free unlimited access to emails. Some of you who are hearing this may not understand or know that people who are incarcerated are paying not just fees, but extraordinary fees, actually, in order to talk to their family members, if there's access at all to video conferencing, and even having to pay for emails. So at this point, again, release as many people as possible, prioritize the general health of staff and those who are incarcerated, and attend to the emotional and spiritual well-being of all. Thank you.
Okay, Carrie, you're up.
Sure. Hi. So what we're looking at with Native communities is that they're particularly vulnerable to the coronavirus pandemic for several reasons. One of the reasons is that Natives continue to die of higher rates of respiratory and heart failure than other groups. Natives also have the highest rate of type 2 diabetes in the country, and the CDC said that these underlying issues put people at a higher risk for complications of coronavirus. In addition to that, Indian country has been chronically underfunded historically, with Indian health services and urban Indian health organizations not receiving the resources and funding they need to operate on a daily basis. They've been completely unprepared for an epidemic of this size. And so that's created a perfect storm for coronavirus to enter tribal communities, and for those communities not to be able to have no resources to stop the spread. And so although Native communities did receive funding in the first 3 packages, there weren't any mechanisms for that funding to actually reach tribes and Indian health services. So what we're looking to receive is meaningful and rapid consultation and deference given to tribes as it relates to C.A.R.E.S Act funding and funding from the other packages. This means that we want tribes to be able to determine what's best for them and their communities in terms of how to use funding. We also need the funding to be distributed rapidly to tribal communities and governments, and for those funds to be flexible to allow tribal governments to be able to determine how to meet the diverse needs of their communities. We also need the funding to be easily accessible to tribes so that they can quickly and easily help to stop the spread of coronavirus. And so another issue I'd like to highlight is the issue of domestic and sexual violence in Native communities. Native women are at a disproportionate risk for violence, with 84% of Native women experiencing violence in their lifetimes, and murder rates of Native women up to 10 times more than the national average in some communities. And so we're expecting to see these numbers spike as we expect them to spike throughout the country due to stay-at-home orders. Victims will be forced to stay with their abusers, and because of the lack of housing and the underfunding of victim services in Indian country, they will have nowhere else to go. So what we would also like to see is increased funding for those victim services, for tribal governments, for Indigenous women's resource centers, and for housing, so that victims and survivors have somewhere to go, especially because a lot of shelters have had to close their doors. So again, we're really looking for tribes as sovereign entities to be able to determine how they're best able to spend the emergency funding, and for the government to give deference to tribes on those issues. Thank you.
Great, thank you. Immigrants are a part of our national fabric. They're valued members of our families, congregations, and communities. And all immigrants make vital contributions to the economy, including those who are undocumented, individuals with deferred action for childhood arrivals and DACA, and those with temporary protected status or TPS. So many of the doctors, nurses, researchers, healthcare workers on the front lines, our healthcare workers on the front lines in protecting America's public health and caring for the sick were born in other lands, as are many of the essential workers keeping our food supply going. All people deserve access to the care they need and to be treated with human dignity. We also know that the anxiety triggered by the pandemic for long-term residents and recently arrived immigrants and refugees is exacerbated by fear of immigration enforcement, suspension of immigration benefit processing, and the large number of asylum seekers in detention. Now is the time for us to come together, citizens, immigrants, asylum seekers, and refugees, to work together through this challenging time. We know when one person is at greater risk of COVID-19, we're all at greater risk. Following the leadership of immigrants, lawyers, and grassroots leaders, these are some of the things that we are urging the administration to act immediately on. Americans are looking for our government to come together and protect all of our communities. Now is the time for unity and smart public health-oriented responses. So for the fourth supplemental package, we're looking for and urging the release of all detained immigrant children, families, and adults so they can stay safe with their families and avoid contracting COVID-19. This includes stopping ICE and Customs and Border Protection enforcement activities. We're demanding the free access to medical tests and healthcare for all members of our communities and the full suspension of the public charge rule. We also need to ensure that testing and treatment for COVID-19 is covered under emergency Medicaid. There also needs to be a delinking of the cash payment assistance from a Social Security number or the ability to file taxes to ensure all individuals have access to those payments. There also needs to be more measures to protect workers, including the automatic extension of work authorizations. The uncertainty faced by those with DACA and TPS causes additional harm at this time, and Congress should automatically extend status and work authorization. Their Interfaith Immigration Coalition has put out a letter that includes these asks, and we also have a letter that has been put out for faith communities and organizations to sign. So those are the asks that we're looking for in the fourth supplemental bill for immigration-related issues. Thank you.
Can you hear me now?
Yes, we can hear you. Go ahead.
All right. Do you need me to start over?
Yes, we do.
Okay.
I think we had
Great.
an issue with your audio.
Okay. So hi, my name is Jacob Greenblatt. I am the Senior Legislative Assistant at the Religious Action Center of Reform Judaism. And alongside my colleague Anne-Marie Bonds from Network Catholic Lobby for Social Justice, we chair the Washington Interreligious Staff Community Healthcare Working Group. And so I'm here to just provide a little bit more of a summary on the third package and outline our top priority asks for the fourth package. So we were really pleased with a number of provisions in the third package, including $100 billion for hospitals, $4.3 billion for the CDC to support federal, state, and local public health agencies with laboratory testing, test kits, and personal protective equipment. We were also pleased with $1.32 billion of emergency funding for community health centers, as well as the extension of a number of federal healthcare programs, including community health centers, special diabetes programs for Indians, and the Medicaid disproportionate share hospitals through the end of November. But we also know that a number of vulnerable communities have been left out in this legislation and in the previous stimulus bills. So in the fourth legislative package, we are calling for free, accessible, and robust testing and treatment for everyone, regardless of insurance or immigration status. The first few bills expanded testing to some extent under public-private insurance, as well as provided some money for uninsured people, but we know that testing is still not widely available, especially for folks on public insurance. We are also calling for increased Medicaid funding for states, including a significant increase to the Federal Medical Assistance Percentage, or FMAP. The Families First Coronavirus Response Act increased FMAP by 6.2 percentage points. However, we need an additional significant increase to that percentage because we know that states are really shouldering the burden in sort of being on the front lines and providing medical care, and they need more federal funding. We are also calling for a special enrollment period for health insurance. We know that just as millions of people are losing their jobs, they're also losing employer-provided health insurance. And for some people, COBRA is an option to be able to maintain their current healthcare plans, but we also know that that's prohibitively expensive for low and middle income families, especially as employers would no longer pay a portion of that monthly premium. And so some states have state healthcare marketplaces, but we need the federal government to reopen a special enrollment period for health insurance to allow people to be able to access care, not only for coronavirus, but also for their routine medical needs. Another one of our asks is a temporary emergency standard from the Occupational Health and Safety Administration, or OSHA, to protect frontline healthcare workers. We know that frontline healthcare workers, whether they're doctors, nurses, or other medical professionals, are putting their lives on the line right now to protect all of us. But unfortunately, many employers are not actually enforcing safety protocols. And so if OSHA issues this temporary emergency standard, that will force them to compel employers to enforce these protocols and protect frontline healthcare workers. And then our final ask is for members of Congress to encourage President Trump to fully invoke the Defense Production Act. We see that he's moved really slowly on this. He's invoked some of the appropriations authority, and he tweeted once to get General Motors to produce ventilators, but he has yet to fully invoke the manufacturing authority of the DPA. And this is really important to compel private industries and manufacturers to produce PPE, and also to allow the federal government to place orders for PPE, so masks, gloves, ventilators, as well as other medical equipment. And this is really needed to help medical providers confront all of the other issues that we've been talking about and really allow them to fulfill our other priority asks. Thank you.
Hi all, my name is Jason Miller, and I'm the Director of Campaigns and Development at the Franciscan Action Network. I'm also the co-facilitator of the Faithful Democracy WISC working group, where we look at voting rights and campaign finance. You probably saw today there's lots of confusion and uncertainty in Wisconsin with the election there, and that's why we need to both protect our democracy and make sure we keep people healthy and safe at the same time. And in order to do that, we need more money. And the $400 million from the C.A.R.E.S Act was a good down payment. And now we need upwards of $4 billion to ensure that we have safe and fair elections. And that $2 to $4 billion for states would require no excuse absentee voting with prepaid postage. We want to extend the voter registration period for at least 15 days of early voting. We want to ensure same-day registration. But we also want to ensure that for those people who aren't able to vote by mail, especially vulnerable communities, that there are contingency plans to protect the health and safety of those voters, and to ensure that there's even online voter registration. But we know that not all communities have access to that. That's why we need to ensure that there are many options as possible to make sure that all Americans have the ability to vote, and that we need to find new ways to allow them to vote while keeping everyone as safe and healthy as possible at the same time. We can both protect our democracy and keep Americans safe and healthy. Thank you.
All right, Becca, I think we can hear you now.
Wonderful. Thank you, Tammy. Hi, everyone. My name is Becca Eastwood, and I'm a co-chair of the WISC Energy and Ecology Working Group. And as our working group is considering the environmental implications of this pandemic, we're both looking at the short-term and the long-term needs. So we know we need immediate economic and health support, as my previous co-panelists have discussed. We must protect lives in this pandemic phase. We also know that we will eventually need to consider the long-term economic recovery that is going to be necessary. So the Energy and Ecology Working Group believes that this is a moment to address not only the health and economic crises that we're facing, but also the environmental crisis. We think that these all go hand in hand together. So we know that both COVID-19 and climate change affect everyone. But we also know that some communities are going to be hit harder than others. The most vulnerable communities, including low-wealth communities, communities of color, tribal nations, developing countries, are all going to be hit the hardest in this. And so we need to have that frame when we're looking at solutions. So COVID-19 is exposing consistently these cracks in our system. And we believe that, as you see in this slide, we need to build back better to a society that is more economically and environmentally resilient when it is facing crises such as we are in now. So what does this look like? As I said, we're looking at both the short term and the long term. In the short term, we need public assistance in any of these packages that are coming out of Congress to be worker focused, especially when we're considering the fossil fuel industry. We believe this is not a time to be propping up industries that are contributing to pollution and to climate change, but we know that the workers in those industries are also losing their jobs. And so any assistance going to these industries must be worker focused. We also, I'm going to add one in here that is on the handout that you'll get, believe it's important to have a moratorium on utility shutoffs. So in this time where, for example, washing your hands is essential, you can't have your access to water in your home shut off because of an inability to pay. And with so many people losing their incomes, we don't want to see access to these basic services such as water, wastewater, heating and cooling in your home to be shut off because of that inability to pay. So we are asking for a moratorium on those shutoffs. If we look at the longer term, one of the things that we are asking for is a transition away from fossil fuel dependence and support the expansion of clean energy. The clean energy industry is also getting hit in this pandemic, which includes the jobs in that industry. Their supply chains are being disrupted. There's a lower demand, as you can imagine, for these services. And we know that in this critical time for our environment, we can't afford to lose the momentum on transitioning to clean energy. And so we need support for those industries moving forward. We also are calling for investments in sustainable infrastructure. So this pandemic has shown that communities' access to quality infrastructure impacts their ability to stay healthy. So if you don't have access to clean water, you are at a higher risk. And so we are calling for investments in sustainable infrastructure, like water infrastructure, public transportation, energy efficiency, and these investments will yield jobs in the long term. The last thing we're calling for is support for the international community. As I said before, this is a critical time for climate, both here at home and around the world. And so we know we can't step away from our sisters and brothers in those countries being hardest hit by both the coronavirus and climate change. And we cannot step away from our international climate commitments at such a critical time in our history. So the only way we believe that we are going to build back better when we're in the position to do so is by addressing these two issues together as they go hand in hand. Thank you.
Hi, my name is Amelia Keegan. I am the Legislative Director for Domestic Policy at the Friends Committee on National Legislation. And unfortunately, Jihad Saleh Williams was having a little bit of technical problems, so I'm jumping in to share kind of the priorities of the domestic human needs focus. So we have kind of in this larger, broader ask around really prioritizing the needs of vulnerable communities. Within the domestic human needs space, there are three priorities. The first is food security. The first three COVID-19 bills failed to really increase nutrition assistance for our most effective nutrition program. That's the Supplemental Nutrition Assistance Program. And we are asking to increase SNAP benefits by 15% and increase the monthly SNAP benefit from $16 to $30. And then as well as suspend some of the administrative rules that prevent people from accessing SNAP. We know that SNAP not only reduces hunger, but it is also one of the most effective ways to stimulate the economy. The second is around housing. So we had some housing assistance in the third package, but not nearly enough. And so we really need more money for housing, homelessness assistance, and a moratorium on evictions. As you all know, particularly people struggling with homelessness are especially vulnerable to COVID-19, oftentimes living in settings in which they cannot self-quarantine, don't necessarily have access to sanitary conditions. And so more money for homelessness and assistance in housing is incredibly important. And then the third thing is really expanded unemployment assistance. The third COVID-19 package did some remarkable work, as Katie said, around expanding unemployment insurance to kind of catch so many people who have fallen through the cracks in the ways that our economy has really changed recently. And so, but all of that really expired. Some of those expansions expire at the end of July and some at the end of this year. And we know that the economy will not have recovered by that time. And so we need to ensure that these expanded unemployment assistance is really available for as the economy continues to falter and is there for people as who are unemployed. So those are the big three pieces of the domestic human needs ask that is under this broader umbrella that unites us all around the need to prioritize vulnerable individuals.
Thank you very much to all of our presenters. I know that that was a lot of information in a very short period of time, but you will be receiving additional information. And what we simply ask you to do is to prioritize vulnerable individuals and communities in a fourth potential COVID-19 legislative response package. Congress is on recess, but we're all at work. But members of Congress are already starting to develop a fourth bill. Now is the time to weigh in with your senators and representatives. And you don't have to be an expert in everything, but you can pick one or two of those specific priorities just covered and speak about it from your place of passion. Now, I'm pleased to introduce Shoshana Abrams, who is the Advocacy Team's Manager for the Friends Committee on National Legislation, who will train us on how to set up and conduct a virtual meeting for a lobby visit.
All right. Can everyone hear me? All right. Thank you so much, John. Hi, everyone. I want to thank you for joining us for this webinar and for committing yourselves to learning how we can make our response to this crisis both equitable and just. It says a lot that during this time of uncertainty, fear, and anticipatory grief, a term that has really helped me, you're here to learn how you can lend your voice to help others. Now, you've just learned a ton of information, as John said, and there are many things we'd like to see in the next congressional package. It's my job to explain how to take what you've just learned and what you'll gather from the materials that we send out and communicate that effectively to your members of Congress. Now, many people believe that Congress does not have the time, capacity, or even the will to talk to constituents right now. But I'm here to tell you that's not true. While all congressional offices are different and many have different levels of capacity right now, at the Friends Committee on National Legislation, we like to think of them as 535 small businesses. And it's those small businesses' jobs to listen to constituents. And it's very much worth you reaching out to have conversations about the things you care about and the things that your community cares about. So, many of you, I'm sure, are experienced in calling offices and registering a thought, opinion, or even an ask or request with an office. But it's our hope that after this webinar, you take it one step further and actually arrange a virtual lobby visit with your members of Congress. The Congressional Management Foundation has long said that the #1 way to influence your members of Congress is through in-person constituent lobby visits. So we know that the more effort you put into your communication with an office, the more weight that communication will have. We won't have time to go through all the details today, so I've included on my slides an important website link that is www.fcnl.org/virtual-lobbying, where you can find all the materials I'll walk through today and even more. At FCNL, we just hosted a virtual lobby event for 500 young adults, and they had more than 130 virtual lobby visits just last Tuesday. And we created these resources for that event. I'll just take a small second to thank and plug here our FCNL Advocacy Teams program. Our 120 advocacy teams lobby year-round in district as well as through conference calls, and their advice and best practices made it into this resource. So if you could go back one slide, I wanted to show you the lobby visit roadmap. So the lobby visit roadmap is FCNL's answer to setting up an agenda and pacing for your meeting with your member of Congress. The one that you see here is set up for a virtual lobby visit. This roadmap suggests roles that can be taken by different constituents in their lobby visit, as well as it highlights and makes clear the most important parts, such as communicating your ask and telling stories as a constituent. The most important parts of the roadmap are these 4. So you want to thank your member of Congress for something, anything, thank them. Setting that positive tone will allow your request to be heard and welcomed by an office. Number 2, make a clear ask. So the overarching ask here is to prioritize vulnerable individuals in the 4th COVID bill. But you want to pick 1 or 2 things from all of the things that we shared that really resonate with you and communicate that to an office. Making clear what your ask is will help the office understand and prioritize, and it doesn't leave anything up to interpretation. It also gives you a good basis for following up and holding them accountable. Make this ask 2 or 3 times throughout the visit. Number 3, tell a story from a personal and community perspective. That is your power as a constituent. You don't need to know all the facts. You need to know why you care about this, and you need to be able to communicate that to an office. And number 4, leave time to hear from the staff or member. Be sure to think of questions beforehand, and remember that a lobby visit is a conversation, not just one person talking to another, telling everything to another person. So the lobby visit roadmap will help you walk through those important elements, and it has some other important tips there as well. Okay, last slide. Thank you. So what we just talked about is how to do a good lobby visit overall, but what's different about doing it remotely? Here I've outlined some pro tips for a remote lobby visit. So when setting up the visit, you email the staffer or scheduler as you normally would, asking for a visit, but make sure you're asking for it to be a conference call or video call. If you're used to in-district lobbying, you're going to want to walk through the Washington, D.C. office or go through the Washington, D.C. office instead. Remember to be patient. This is a crazy time for all of us. Many staffers are working out of their kitchens like many of us around the country are doing, but continue to be persistent. As you're setting up these visits, be sure to tell them what you want the visit to be about, who will be joining you, and make sure that you note that you're a constituent. Pre-lobby visit prep. As you prepare for your lobby visit, be sure to meet as a group and discuss your plan. You could even fill out that lobby visit roadmap. Remember that during a virtual visit, you don't have any of those visual cues that we often rely on. During the visit, join the call beforehand and test the tech. That's really important anytime these days. Make sure that you don't have any distractions in the background and that you know where best the internet connection works. Be sure to ask at the very start of your meeting how much time you will have. That may have changed. The sound working?
Yes, your sound's just fine.
Okay. All right, great, sorry. So you want to make sure that you test the tech beforehand and that you check with an office to make sure the amount of time that you have before the visit. You won't be able to see them checking their watch or getting up to leave the meeting. And then post-visit, most importantly, you need to follow up with an email immediately afterwards, giving a thank you and listing the constituents who are on the call, and give them any leave behind materials that you want them to have. You'll want to again follow up in a couple weeks just to see what the office's response was to the request that you've made. So if you keep these things in mind, I think you'll be quite successful for your virtual lobby visit. I want to thank you again for taking important action at a critical moment and wishing you all a peaceful holiday. Back to you, John.
Great. Thank you very much, Shoshana. We have just a very short period of time to take a couple of questions, and we have one populated already. And the question is, on SNAP priorities, does suspending the administration's SNAP rules include the public charge rules? And the simple answer to your question is yes. The other question that we had lifted up was a note about concerns for the disability community. And I think we all speak unified when we say that people who are in the disabled community, hearing impaired communities, other communities that are differently abled, we want you to know that we are including you in the work that we all do together. I want to spend a moment here to just say thank you to everyone for your time and your expertise. I want to thank everybody watching this webinar right now who have taken time out of their schedule to spend some time finding out more about these important issues and ways that the faith voice can be effective in the future. I think we will post an email out, the PowerPoint, as well as a fact sheet with all of our policy asks. We would be remiss in not sharing that the best policy advocates in Washington are you. And with that, I'll close this out with a closing prayer. So if you all join me now. O God and Creator, our peace and our strength, we pray for our nation and the world as we face new uncertainties around coronavirus. Protect the most vulnerable among us, especially all who are currently sick or in isolation. Grant wisdom, patience, and clarity to healthcare workers, especially as their work caring for others put them in harm's way. We pray too for all in elected office, that they may discern wisely, all in your care. Guide us as we consider how best to prepare and respond in our families, houses of worship, workplaces, and communities. Give us courage to face these days, not with fear, but with compassion, concern, and acts of service, trusting that you abide with us always. Amen. Thank you all. This concludes today's webinar. Be safe and be well.
Thank you everyone for joining us. I just want to note that you can access the handout that WISC has prepared. It's in the handout pull down on the right-hand side of your menu, and we'll also be sharing that out, and we will be sharing a recording. Thank you, everyone.